Let's discuss about an autoimmune disorder called as rheumatoid arthritis. This rheumatoid arthritis is the most common inflammatory multi-system connective tissue disorder associated with arthritis. This condition is more commonly seen in case of females than that of males. Many genetical factors and also environmental factors are found to have a role in the development of rheumatoid arthritis. In case of rheumatoid arthritis, the patient often presents with the complaint of morning stiffness of joints, of particularly small joints, that is fingers. Most of the when complaint of morning stiffness, we need to evaluate for the condition called rheumatoid arthritis. And what is the pathogenesis mainly involved is that in case of rheumatoid arthritis, genetic factors and environmental factors produces autoantibodies against the synovial proteins, that is citrullinated protein. So these anti-citrullinated proteins, anticyclic citrullinated proteins are the most specific autoantibodies produced in case of rheumatoid arthritis. And in this case, the main site of lesion is the present in rheumatoid arthritis is the synovium. So synovium is the affected in case of rheumatoid arthritis. And as I already said, the most common clinical feature present is the painful joints and also tender joints, and also swollen joints will be seen, and also the patient complains of morning stiffness. Let's discuss about an autoimmune disorder called as rheumatoid arthritis. Rheumatoid arthritis is the most common inflammatory multi-system autoimmune connective tissue disorder with arthritis. And the site of lesion seen in case of rheumatoid arthritis is the synovium. And pathogenesis mainly includes is the genetic factors and environmental factors causes abnormal protein modification, that is citrullation or carbamylation, as a result of which the antibodies are produced against these abnormal proteins by the T cells, and they form the immune complexes and causes the damage, leading to the pathogenesis of the rheumatoid arthritis. In this whole process, TNF alpha is the most important cytokine involved in the rheumatoid arthritis. And let's see the genetic factors and the environmental factors seen in case of that would trigger rheumatoid arthritis. Genetic factors mainly include the HLA factors HLA-DR-B104, HLA-DR-B101, HLA-DR-B113, PAD1-4 gene, PTPN22, CTLA4, APOM. These are genetic factors which are seen in case of rheumatoid arthritis, and the other environmental factors which include are the smoking, silica, infections of Porphyromonas gingivalis, that is chronic periodontitis. All these are the triggering factors to development of the rheumatoid arthritis. And we need to observe that distal interferon joint are usually spared in case of rheumatoid arthritis. Let's see the clinical features of rheumatoid arthritis. Females are more commonly affected than that of males, and pregnancy induces remission, and the age most commonly seen is 40 to 60 years of age. And the clinical features are mainly the morning stiffness is the most common complaint given by the patient, and joint distribution we need to observe, and we see a tender and swollen joints. And some specific tests which help us are the C-reactive protein, anticyclical citrullinated polypeptide, ESR, erythrocyte sedimentation rate, and rheumatoid factor. These are the specific tests which help us in arriving to the diagnosis of rheumatoid arthritis. If we don't treat the rheumatoid arthritis at the earlier hour, that is at the earlier period, then there are many chances for development of deformities. And the deformities which we see in case of rheumatoid arthritis are Botany deformity, swan neck deformity, Vaughan-Jackson deformity, intrinsic plus deformity, opera glass deformity, hammer toe, hallux valgus. We need to observe that axial skeleton is completely spared in case of rheumatoid arthritis. And let's have a brief look on the extra-articular manifestations of rheumatoid arthritis. Rheumatoid nodules is the most common extra-articular manifestation, and these nodules are pathognomic of rheumatoid arthritis, and these nodules are usually painless, and the most common site is the elbow than that of finger. And other system involvement like central nervous system, we see quadriparesis. If peripheral nervous system is involved, then the patient experience ulcer, gangrene, mononeuritis multiplex, and ocular manifestations like scleritis, dry eyes also seen. And we also see the hematological manifestations which causes anemia due to chronic disease in the patient. And lung manifestations mainly includes pleuritis with or without effusion, interstitial lung disease, even the synovial involvement also seen in the form of synovitis, Baker cyst, and olecranon bursitis. And let's look into the treatment plan that is available for the what can offer to the patient of rheumatoid arthritis. The main objective of the treatment is to lower the activity of the disease, and the most common drug that is used is the methotrexate. And the course of treatment goes as like 5 days of methotrexate with 2 days of folinic acid. And the most common side effects related to methotrexate are the cytopenia, mucositis, and hypersensitivity. And other biological agents also used in the treatment of rheumatoid arthritis, that is like anti-TNF alpha, etanercept, infliximab, adalimumab, cetuximab, golimumab. All these are TNF alpha inhibitors, and other drugs used are the anti-IL-1 antibody, that is anakinra, anti-IL-1/6 antibody tocilizumab, anti-CD20 antibody rituximab, abatacept, that is fusion molecule also used. This is all about rheumatoid arthritis, and thank you for watching.